Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 64-year-old patient presents with new onset anxiety. She denies any history of anxiety disorder or any psychiatric disorder previously in her life, but for the last 9 months, she has been having episodes that she describes as, quote, attacks. Out of the blue, she will develop a sense of racing heart, hyperventilation, numbness and tingling in her arms, and feeling lightheaded. She worries about this a lot and now worries virtually all the time about why this is happening. It is causing difficulty with sleeping, and she finds herself being very irritable at home as well as at work. These episodes last for a few minutes and then subside on their own. She takes medication for high blood pressure and high cholesterol, but otherwise reports being very healthy. What aspect of this scenario is suggestive that there might be an underlying organic cause of her symptoms? All right, an assessment question, and it's an excellent one. Again, a concept that I suspect you will be expected to understand and demonstrate your understanding in the form of a test question. What it all comes down to here is what aspect of this scenario is suggestive that there might be an underlying organic cause. This is a really important skill for all psych mental health nurse practitioners to be aware of and to develop and implement, because, we all tend to see things through our own lens. When you work in a psychiatric practice, it's very typical that when someone comes in complaining of a symptom like anxiety episodes, we just, of course, assume it is an anxiety disorder. It's how our brain works. Just like if you have chest pain and go to a cardiologist, the cardiologist is going to have a predisposition toward a cardiogenic cause, whereas a gastroenterologist is going to be thinking about a GI cause. So we all do it. We just have to be very aware of that and not drill down or narrow down too soon. So to that end, an important skill that we always have to be aware of when making an assessment of a new patient complaint is that it might be due to an underlying organic or physiologic abnormality. So it gives you a scenario, but the real question is, what aspect of this story suggests this might be an underlying cause? Okay, we have 4 answer choices here. A, age of onset. B, character of episodes. C, medical history. Or D, duration of episodes. What aspect of this scenario described to you is suggestive that there might be an underlying organic cause of her symptoms? And in this case, it's A, the age of onset. A is the correct answer. Physical or organic causes of psychiatric diagnoses, like I said, they should always be considered in the differential diagnosis. And I know it's easy for me to say it and we all nod our head, but in day-to-day practice, sometimes we have to purposely remind ourselves of that. Anyway, the point is we should always be considering an underlying organic cause. And sometimes you can consider and reject that very quickly, but there are certain features that increase the level of suspicion, including later age of onset. It is most unusual that a 64-year-old patient will develop a new anxiety disorder without any psychiatric history at all. Can it happen? Sure. There's 8 billion people on the planet. Surely it can happen to somebody, but it's most unusual and is a total red flag that there is more likely an underlying organic cause. In this case, the character of episodes themselves could certainly be consistent with an anxiety disorder. I mean, everything that's described here, even the numb arm, which many times people will say, but wouldn't we worry about a stroke or wouldn't we worry about an MI? Remember, she's hyperventilating. And when you hyperventilate, you blow off CO2 and become hypocapnic. And it is very common to have numbness or tingling because of the hypocapnia. As soon as the patient calms down and slows their breathing, that will resolve. So that alone really isn't something in this scenario that's a red flag for an organic cause. Further, for her, her medical history is not suspicious for producing psychiatric symptoms, and the duration of episodes could certainly be consistent with an anxiety disorder. Again, she's got no medical history reported here that suggests, if she had hyperthyroidism or even anemia or a condition that could produce like a hypoxic state or a hypermetabolic state, but she doesn't have any of that. So there's nothing in her history that's suggestive of an organic cause. The duration of episodes could certainly be consistent with an anxiety disorder. The only thing here that really stands out is the age of onset. This is very inconsistent with the mental health diagnosis. The late age of onset, the complete absence of any mental health history, but there's a ton of them. Other findings suspicious for a medical cause include an underlying medical condition known to cause psychiatric symptoms, atypical presentation. Like if the story just doesn't sound right in any way, that's a trigger to consider an organic cause. Poor response to usual treatment. And I don't necessarily mean the first treatment, because not every mental health patient responds to the first treatment. But if you make a diagnosis and you implement a treatment modality and give it a real, a fair shot, and that doesn't work, and then you go to the next appropriate treatment modality, if you're still not getting any response at all, that is a clue to consider an underlying organic etiology. And abnormal vital signs, of course. I think that's pretty obvious. And always underlying substance use. Patients don't always share this with us the first time we ask. But if there's an underlying substance use problem, of course, that can, or maybe they don't even see it as a problem, but if there's consistent underlying substance use, that also can mimic a psychiatric disorder. But it really isn't a psychiatric phenomenon. It's the consequences of a physical manifestation.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.